Dr. Alexander Rivkin, thank you so much for doing the interview with us at the Rhinoplasty Network. I wanted to find out a little bit more about you, how long you've been in practice, and so forth and so on.
Sure. So I've been in practice so far for 7 years now, and doing non-surgical cosmetic procedures exclusively at this, for those 7 years. And I came to Los Angeles from my ear, nose, and throat head and neck surgery residency in San Diego, and before that, medical school at Yale and undergrad at Columbia. And so I've been mostly on the East Coast, and now I'm here for the weather.
Whatever. So Yale and Columbia.
Yeah.
So you must be pretty educated.
Well, it's a lot. We spent a lot of time. Yeah.
Yeah. That's good. So then, I wanted to ask you more specifically about what we do. Our website obviously is more primarily about rhinoplasty and revision rhinoplasty, and I wanted to speak about revision rhinoplasty a little bit.
Okay.
A lot of our patients who are looking to have revision rhinoplasty are looking at anywhere from $15,000 to $25,000 procedures to get their noses fixed. A lot of them have indentations in their nose, or the bridge of their nose is not very strong enough and stuff. Is there do you have a solution for them? Is there something you can offer them?
Yeah, I think so. I mean, I think that after someone has rhinoplasty, they can have a very good result, and when it's a good surgeon, it's usually a very good result. The trouble is that sometimes scarring, even with somebody who's quite good, can be a little bit unpredictable. So I think that there's alternatives nowadays to surgical revision, which I think are valid alternatives, and I think are very valuable alternatives. When somebody gets a rhinoplasty, their results are usually quite good if they go to a good surgeon, specialist in the field, and specialist in rhinoplasty. Get good results. Unfortunately, the scarring sometimes can be a little bit unpredictable, especially 5 years, 10 years, 15 years out. And they can develop slight asymmetries or little mild indentations, and it's hard to predict how it's going to scar exactly, and that it's perfectly smooth, and all that. So when they have those kinds of little contour things that bother them, what I've seen is that filler injection, either permanent or temporary filler injection, can really solve the problem easily and cost effectively, and minimizing the risk, minimizing the expense, minimizing the pain and trauma involved as well. Because why go through a second surgery where, as we all know, that secondary, revision rhinoplasty has increased risks, quite significantly increased risks from the primary procedure. It has significantly increased expense, and it's just when you can do a simple injection that works really well, and that's very, very precise, which is something that surgery, surgery with no offense to the surgical field, but because I've done it, I've done rhinoplasty, and I know that there's a certain precision that rhinoplasty can achieve, and it's difficult to be spot on with slight contour abnormalities. So it's much easier to do a little injection, and that's it.
Okay. So let's say you mentioned if somebody had a good rhinoplasty. Now let's say somebody who had an unfortunate rhinoplasty where they took off the bridge of their nose, or there's just significant indentations in the side of their nose, or what have you. Would this really help them out as well?
Well, and I've seen some of that as well, and I've seen actually the worst of it I've seen has been primary rhinoplasties done abroad, and so people will come in who have had their rhinoplasties in a different country, and it's just there's issues with it in terms of over resection and poor symmetry that you don't really see in the States in terms of quality of the work. I have found that again that filler injection can help with those kinds of issues. Now, in terms of, there is a certain limitation. Sorry, so let me just backtrack. There's a certain limitation to what fillers can do, and it's not, they can't necessarily move the tissue as much as is possible with surgery. And so when you have a significant asymmetry or significant twist in the nose, it's hard to do with fillers, as is it's hard to do with surgery as well. But it's very because only fillers can only add. It's hard to it's hard when it's a significant asymmetry. It's hard to correct it without significantly increasing the width of the nose, which is something that most of the time people don't want. So I think that so it's the answer to your question is that it's a individual case by case determination, and when somebody is a specialist in injection rhinoplasty, he can tell who is appropriate and who is not appropriate. So at this point, I can tell who I need to refer to my colleagues, and there are several very good revision surgeons in Los Angeles, and I referred the cases that I can't handle to them, and they do a great job. So, and which cases I can handle myself using fillers. And sometimes it's not obvious, because sometimes what looks to be a case that would be easy with fillers, sometimes there's so much scarring underneath the skin, and it's hard to move the tissue up, because that's the real key. Anytime you're doing injection is movement of the tissue, and if there's too much scarring, it just won't come up. So yeah.
Okay. So but if somebody if a surgeon did take down a bridge of the nose and somebody did want a stronger nose, it is possible to build that bridge of the nose back up.
Absolutely.
Using fillers.
Absolutely. No, and then in specific cases, building the bridge, a collapsed bridge is not that difficult to build up using fillers. Again, assuming that there's not a lot of scarring in that bridge area underneath the skin, and usually there's not that much. So the collapse that you see with, for example, saddle nose deformity, or the collapse that you see with just cartilage collapse of the nose post rhinoplasty due to over resection, is really fairly easily corrected with fillers, and you can do. What I usually do is I use temporary filler like Radius, or I even use hyaluronic acid sometimes, because it's reversible. So that's very, very, it's very temporary. Right. And if somebody, so I can use a temporary filler like that, make sure that the result is exactly what the patient wants, make sure the result is exactly what I want, and that it's a good, that it's a good result. And then once that filler fades, replace that with a permanent filler like Artifil, which frankly I've used on probably about 250 patients so far.
Wow.
And I've had excellent results, because I've been using Artifil now for at least 3 years, and I've been always offering that option to people, that if you like your non-surgical rhinoplasty and you'd like to make it into a permanent procedure, once the temporary filler starts to fade, come on back and we'll start layering in Artifil to replace that temporary filler.